A quick note before we start. This will be my last episode as the host and producer of Three Things. Arun George, who you have heard on the show the last 2 weeks and has been an integral part of our team for a while, will be replacing me. A big thank you to our listeners for helping us grow this podcast in 2 years and 850 episodes into one of India's leading news podcasts. Thank you for your kind words, support, and be assured that Three Things is only getting bigger and better. So long, and thanks for all the love. Now back to the show.
Hi, I'm Neha Matthews, and you're listening to Three Things, the Indian Express news show.
Over the course of the novel coronavirus pandemic, we've covered various aspects of it. Right from the beginning, when we talked to an Indian student stuck in Wuhan, to this month where we have covered various topics, treatments being tried, testing strategies, the effect of the lockdown on migrant workers and people who are stranded, among other things. It's important for us, however, to understand how COVID-19 affects the body and what recovering means. In the ICMR press briefing yesterday, Love Agarwal, the Joint Secretary of Ministry of Health and Family Welfare, said that the recovery rate in India has now improved to 25.19, while the case fatality stood at 3.2.
इस तरीके से अगर हम देखें तो हम पाते हैं कि हमारे देश में टोटल रिकवरी रेट प्रेजेंटली 25.19% है। रिकवरी रेट के अंदर हम एक प्रोग्रेसिव ट्रेंड ऑब्जर्व कर रहे हैं। जैसा कि आप लोगों को इससे पहले भी बताया है कि 14 दिन पहले का अगर रिकवरी रेट देखें तो वह 30.06% था, जो कि अब बढ़कर 25% के ऊपर पहुंच गया है।
On this episode, we look at what recovery means. We will hear from a woman who tested COVID-19 positive, showed mild symptoms, and is in the process of recovering now.
There is no need to panic. That is the take-home message.
We will also hear from health reporter Asta Saxena on how our hospitalization policy is going to change in order to better deal with severe cases. But first, we are joined over call by Dr. Swapnil Parekh, a practicing physician and the author of the book, The Coronavirus, What You Need to Know About the Global Pandemic. Dr. Parekh helps us understand, in the simplest terms, how COVID-19 affects the body, how a person recovers from the virus, and whether severe cases are going to face long-term problems. Before we talk about recovery, it is important to understand how COVID-19 affects the body. Dr. Swapnil talks about the 3 ways in which the virus attacks our body.
First, let's start with, the fact that it's the virus, the SARS-CoV-2 virus. So it's the severe acute respiratory syndrome coronavirus 2. And that causes COVID, which is coronavirus disease 2019. So it's kind of like how HIV causes AIDS. So the SARS-CoV-2 virus causes COVID-19. When this virus infects an individual, and there are a variety of ways that can happen, when it does, it opens a special kind of protein on it called an S receptor.
Dr. Swapnil has a simple analogy to explain how the virus enters the body. Think of this S receptor as a key. The lock is an enzyme in our cell membranes called the ACE2.
So when the coronavirus S protein key opens the ACE2 lock, the virus can infect a cell. It just so happens that the cells in the respiratory system, that's in our lungs and in our nasal passages and throat, have a lot of these locks, these ACE2 locks. And when the virus infects these cells, it starts replicating inside them. It starts making more and more copies. So that brings us to the first area where it can cause damage, which is the virus itself replicating inside the cells, infecting cells, can directly cause damage. When these viruses are released from the cells, they go on to infect other cells. Our body has a special system known as the immune system, and it is based on what we call white blood cells. These white blood cells in our body can detect the virus. When they detect the virus, they launch a counterattack. They try to destroy the virus and they try to kill any cells that are infected by the virus. In this process, sometimes the immune response can become dysregulated. It's a process we call cytokine storm. So when this storm happens, the immune system itself can damage the body. That's a second way in which damage can happen, a second theory rather. The third theory, and something that's emerging more and more now, is that this virus, because it infects these ACE, like the ace of spades, these ACE2 receptors, that's where a lot of the problem is happening. The blood vessels in our body, they have a special layer of cells, just like our skin has cells on them, even the blood vessels have cells. And those cells also have a lot of these ACE2 receptors. And the virus can actually infect the cells in the blood vessels. So, people who already have damaged blood vessels, like diabetics, or people who have high blood pressure, or heart disease, or smokers, when they already have damaged blood vessels, the damage can become too much. And when it damages the blood vessels, it can cause the formation of blood clots, tiny, tiny blood clots. And these blood clots can happen in the lungs. And when that happens, they stop the flow of blood through the lungs for oxygenation. So these are the three main ways that we think damage is occurring to the body because of the coronavirus.
Now, how far the virus progresses and what damage it does differs from mild cases or asymptomatic cases, which, as we know, the ICMR recently said is about 69% of positive cases till date, to more severe cases.
We think that in mild cases, the virus gets defeated by the immune system in the nose and throat. And in severe cases, it might spread further down into the lungs. We also think in mild cases, for whatever reason, the immune system doesn't kick into overdrive. And in severe cases, the immune system may kick into overdrive. And then there is the question of pre-existing illness or elderly individuals. So people who are already not in the best of shape, then when they get hit by this, their body can be overwhelmed.
Now, say we are exposed to the novel coronavirus and the key opens the lock. How long then does it take for us to start feeling sick?
Firstly, let's understand when a virus causes an infection, you don't fall sick right away. This is something we call the incubation period. So during this period, the virus is forming more and more copies. And when a person falls sick, when they actually start feeling symptomatic, then the incubation period is over. So the time from infection to when the person actually develops symptoms is called the incubation period. For this virus, it's generally around 5 to 6 days, but it can extend anywhere from 1 day to 14 days. Some people may never develop symptoms. And early evidence on this shows that a sizable percentage of people aren't developing any symptoms. And then another sizable are developing such mild symptoms that they don't even realize. So, they're just like a mild cough or a slight sore throat, something that they can ignore.
That brings us to recovery. How does a person recover from COVID-19? And how do healthcare workers ascertain that they have indeed recovered?
We look at it in two ways. One is the patient feeling better symptomatically? And the second is, have they recovered from the virus replicating in them? So are they still going to be infectious to others? I say the first one, it's easy. It's like, has your fever gone away? Has it been at least like about 3 days where you've not had fever and you haven't taken any crocin or any medications to reduce fever? Has your cough significantly reduced? Is your breathlessness better? How are you feeling in general? Are you able to, get back to more of your activities or almost all of your activities? So that's in terms of the clinical or symptomatic recovery. In terms of the laboratory tests, what we do is we take 2 swabs. So a swab is something we put into the nose and the mouth to test for the virus. And we take 2 of these at least 24 hours apart. And if at least 2 of them back to back are negative and the patient has recovered clinically, then we can reasonably assume that the patient is no longer infectious. So those are the 2 metrics by which we would classify the recovery.
From other countries, we're hearing first-hand accounts of people who could perhaps be classified as milder cases, and they talk about how recovery is not a linear phase for them. There are good days and there are bad days. Their symptoms sometimes show up in cycles. So what could be the reason for this?
We're starting to tread dangerously close to speculation at this point. This is a very new virus. It's a very new disease. There's very little we know about it. We have theories, so it's just important to point that out. I can give you an answer, but subsequently we might find out that this theory was incorrect. So we do see this in some other infections. We see what's known as a biphasic or a triphasic infection. So dengue is a really good example, where people develop a mild infection initially, mild symptoms initially, because of the virus itself. And it's something we call the viremic phase. After that, they recover for maybe a day or two, their fever goes away, and then they suddenly worsen because their immune system has kicked in, and the virus can actually use the immune system to worsen the disease. It's tricky. That's with dengue. So one theory is that maybe the coronavirus is acting in a similar way. It's too early to say anything conclusively, but that's one theory. Another thing is we see this with other pneumonia. So we see something called walking pneumonia with a bacterial infection, where the person is sick. It's just there are some changes in them where they are not able to perceive how sick they are. And they aren't necessarily very symptomatic. But when you take a chest x-ray, you see pneumonia. And maybe when you check their oxygen levels using a device you put on the finger, their oxygen levels are low. And we are seeing that also with this infection. Like people seem to be able to go about many of their activities. They don't feel very sick. But when we objectively look at their x-ray or their CT scan or their oxygen levels using this finger pulse oximeter, then they appear very sick. So it's possible that they feel they have a mild infection, but the virus is actually really causing problems inside them.
While we discuss recovery from mild cases that form the majority, it's important to understand that even if 15% of our positive cases are so far severe and only 5% are critical, this is still a sizable amount. As the number of cases grow, this 5 and 15% is a lot of people in absolute numbers. So what does recovery look like for them? And are they left with long-term problems with the damage the virus does?
It's a very important question. And again, sorry, I'm not trying to be evasive, but just to point out, we only learned of this virus in January, and now it's about to be May. So, in what context can we describe the long term effects? I mean, the virus hasn't been around for long enough to know what the long term effects are. But with that qualification, with that in mind, what we are seeing is that, yes, so firstly, remember, patients who are critically ill, even with the best of care, only about half of them will recover with the best of care. And in some institutes, the mortality rate with patients who go onto ventilators is as high as 70-80%. So of the small number who recover, and keep in mind that while it's easy to say that, yeah, it's only 5%, for someone like me who's a doctor, for my colleagues, this is the vast majority of people we see, like the severe cases. And it's a huge number, not necessarily right now, but potentially. And there are going to be long-term effects in these people. We just don't know what they are yet. We do see them with other illnesses. So what this is causing is what's called acute respiratory distress syndrome. And there can be long-lasting lung damage after that event. So you may not ever have the same lung capacity that you had before you got infected. There are changes that are happening in the kidneys. The kidneys also have those receptors we spoke about, those locks. The immune response to the virus itself can damage the kidneys. And then you have to keep in mind that a lot of the severe cases are people who had diabetes, heart disease, hypertension, kidney problems. So they weren't going into it with the best of kidney function to begin with. So similarly, there can be a wide array of long-term effects. We don't know what they are. And then the process of being in the ICU, the various treatments, the various measures taken to just make the person survive, that itself can have a toll on the body. Something we see sometimes in the ICU, especially with patients who are on ventilators, and especially for ones who are there for a long time, is we see something known as critical illness, myopathy, neuropathy. Irrespective of which illness it is, the fact that you are in the ICU for that long can have damaging consequences to the body. There's something known as post-ICU syndrome, where, the person is immobilized for so long, they lose a tremendous amount of muscle mass, their coordination is not as good, they can have memory issues, they can have post-traumatic stress disorder. So there are a lot of potential long-term effects that can happen. We have seen those similar long-term effects in other diseases. But let's be realistic, we haven't been through the long term of this virus. All I can tell you is it's likely to be devastating. We don't know how devastating.
Now, many people who have tested COVID-19 positive and are on the road to recovery primarily have one question. Are we still infectious?
Again, I'm sorry, but we don't know exactly. But here's what we do know, that people who have recovered can still test positive, not just in swabs taken from their nose and mouth, but also in their stools. We've seen this with other similar viruses like SARS and MERS. However, like I explained, the test is difficult to differentiate between the RNA fragments that may not necessarily be infectious and infectious virus itself. To understand this, what the kind of studies we need to do is we need to actually try and grow the virus in the lab. And if it grows, then you know that that person is infectious. This is a dangerous thing to do right now, because of course we need to do it. But it's a dangerous process trying to grow this virus in the lab. You need highly specialized facilities, highly skilled scientists to do this. And we're going to figure it out. But right now, yes, we should assume that people who have recovered are potentially infectious. And there's no simple answer to this, but depending on when the symptoms started, you might need to be at home for 7 days, you might need to be home for 10 days, you might need to be at home for 2 weeks from the onset of symptoms. So it varies. There are a lot of different permutations and combinations.
To wrap up, I asked Dr. Swapnil about what the Health Ministry said yesterday about India's recovery rate increasing to about 25%. What should we make of this information?
Here's what we need to remember, that this relates to the number of confirmed cases. That is the number of people who have been identified. The number of people who've been infected and may have recovered without even knowing they were sick might be significantly higher. So the number of recoveries, it's an important distinction to make between the total number of infections and then the total confirmed cases, which is a small number in that bigger number of total infections. So the number of recoveries is likely to be higher than we actually think it is.
Now that Dr. Swapnil explained what recovery looks like, it could perhaps be good to hear from someone who went through the process themselves.
There is no need to panic. That is the take-home message.
This is Dr. Richa Devikar, a 38-year-old radiologist who works at NHS London. About 4 weeks ago, Richa was diagnosed positive for COVID-19. Although she's younger, Richa suffers from an autoimmune disorder, which made her more vulnerable to the virus. Thankfully, she's currently on her path to recovery. And while according to Richa, she experienced a mild case of COVID-19, and since the majority of COVID-19 cases are mild or asymptomatic, we thought it would be useful to hear a first-hand account of what the road to recovery looks like. There are a few caveats. Dr. Richa is currently in London, and the policy of hospitalization tests there is different. Under the WHO's transmission classification in their daily situation report, the United Kingdom is categorized as having community transmission, whereas India is currently in the cluster of cases category. And as we know, the government has till date denied that we have reached community transmission. So keeping these differences in mind, it is worth listening to Dr. Richa's experience as the number of cases in India starts to increase more and more. To start, Dr. Richa explains how she first noticed symptoms and when she got tested.
So this was the beginning of April, the first week of April. I was working all the week, and towards the end of the week, Thursday or Friday, I just noticed that I did not feel taste and smell, the sense of taste and smell, because whatever food I was eating, it was so bland and it was so tasteless. I felt like I was chewing rubber. That was a very strange feeling that I first noticed. The next morning, or rather late night, early morning, I woke up with shivering and chills. And I woke up and I checked my temperature actually, because I thought I had fever, and I actually had fever. I took a paracetamol. I went back to sleep, and it was something like 2 o'clock in the morning. So I went back to bed and I was okay without fever. But this fever kept on coming round the clock. So I had fever every 6 or 8 hours on Saturday and Sunday. And that is why Sunday I contacted the staff COVID clinic in our hospital, and I gave them a ring to find out if I am eligible, whether I should have a swab. I just seek their advice. Now, the background is I'm suffering from a certain autoimmune condition, and I'm being treated for that. I take immunosuppressants, so my immunity is towards the lower side always. And with this background and these symptoms, and with the new London being the epicenter of COVID in UK, and I have a small baby who's like 2.5-year-old who goes to the nursery when I go to work. All this, I knew, all this made me more prone, more vulnerable to catching a COVID infection. Sunday evening, they gave me an appointment. They gave me a slot, they took my swab, and next day I got a call from the staff COVID clinic that the swab was positive. They asked me to isolate because it's in the community now, and that is a policy in NHS that we don't do hospital isolation for mild cases, and I was in the mild category so far because I had just symptoms. I did not have any air hunger. I didn't have any breathlessness. They asked me just home isolation for 15 days. In fact, all three of us, they advised home isolation for 15 days. So when I got the phone call, my baby was in the nursery. I called up my husband. He took the baby from the nursery and he came home, and then we isolated for 2 weeks after that.
To recap, Dr. Richa started feeling the symptoms, got the test done in the second day of facing symptoms, and on the third day, she was diagnosed positive for COVID-19. Notice how important it is to recognize the symptoms and be able to access healthcare fast enough and be allowed to get tested. Over that week, her symptoms progressed.
I had fever, like I said, round the clock. Every 6 or 8 hours, I used to get the fever. The fever was never beyond 38 degrees Celsius, which is like what we say 100, around 100 degrees Fahrenheit. This fever was always accompanied by pain in the joints. So, like we have a viral flu kind of thing, exactly that kind of presentation. Pain in the joints and body ache, pain in the muscles, and loss of taste was still there, loss of flavor of food and all that was still there. And this used to go down even if I didn't take any paracetamol during the day, which I did not take. I avoided. We all of us do that, right? Kyun faltu mein medicine khana hai? So, chalte hai, let's see. And it used to go down by itself. What I always used to do was drinking enough water. And this is what was also told to me by the A&E staff. Ki whatever water you take normally, like all of us have a normal routine for tea, milk, coffee, juice, whatever, one quota. Whatever we take over and above that, I used to measure and take 3 liters of water H2. I used to take electrolytes. So what we say electral solution or isotonic solution, ORS kind of thing.
Soon, on maybe the 9th day, Dr. Richa started feeling better. Remember what we discussed with Dr. Swapnil about how recovery is not linear? This seemed to be the case with Dr. Richa as well.
I had this for 7-8 days and it just went off on its own. It went on waning gradually. And then one fine day, I did not have any fever. And then 2-3 days, I did not have any fever at all. And then I thought, okay, everything is fine now. And I'm happy. And then I still have 5 more days to go of holidays. And I'm thinking, okay, now I was planning, I'll do this, I'll do that, I'll read this novel, I'll watch this movie. You have your pending list, time nahi mila, ye hua, wo hua. So I can do this, I can do that. I was thinking, contemplating and happy about it. And then it was day 10 when all this fever and thing was over. And then day 11, I started feeling ill again. And then when I spoke to other friends who had also got COVID infection before me, maybe, this was again a very common experience to them as well. There is a recovery period and then there's a dip again. So this is the natural course. When I had fever, I also had cough and chest pain. The cough was more in the night. During the day, I did not have too much cough. Chest pain was there with the cough and without the cough as well. And the cough was dry. It was not like the URT, the sneezing and common cold and that kind of cough. It was only a dry cough. And then all this ended. And on the day 10th, I felt more ill again. And now I knew what they mean that, okay, there is a second phase of the disease, a second week, when things can spiral downhill. And this is, I think, the time when you have to be more vigilant.
At this point, she visited the hospital again and got her vitals checked.
And when they saw my blood pressure, it was very low. My pulse was very high. It was like 130 beats per minute.
I was wondering, outside of the physical symptoms that she was facing, how was Dr. Richa mentally? Was there any stress? It does help that she is a doctor and has read a lot about what the virus does to you, had reliable help in the form of healthcare workers. But how did this affect her?
I knew this is something manageable. And if I'm vigilant about it, we can deal with it. So I was positive. I was more positive about it. And all of us should be.
So when did she realize that she was recovering?
This was at the end of 2 weeks when my symptoms were improving, the ups and downs in the blood pressure and heart rate and all that. And that was the point when they were a little worried about it. And I did not get admitted, but that was the only point when I went once to the hospital. At the end of that week, I got a swab done again, and then that swab did not show any new viruses. So at the end of those 2 weeks, there was no viruses in my blood. Clinically, I was better, improving in my symptoms. One thing I still have is the loss of taste. So I think that will take time.
Now she feels good enough to start working from home. She has received clear instructions: take a lot of fluids, don't exert yourself, don't try to be a superhero, and know your body. So to end, I wanted to ask her what she would like to tell people anxious about getting the virus.
This is an infection that definitely takes a toll. This is not to scare any of you guys, but this is just to stay vigilant. But having said that, like I said in the beginning, my message is don't panic. Don't worry. Don't be anxious. Be positive that you can deal with it. We are all in today's era where we are all well informed. We know what to do about everything. We have all these things at our fingertips. We can call for help. We can call for doctor. We can call for anything that we want. And there's no need to panic, but be careful, be vigilant, be watchful, be converse with your body, talk to your body, know what is happening to it, and look out what to do for it.
Last, we talked to Asta Saxena, who reports on health in Delhi about how hospitalization policies are changing for COVID patients. How will mild cases be treated? And how will people who can't safely self-isolate at home, particularly the poorer population, be helped?
So initially, we were having all the patients even showing milder or moderate symptoms admitted to the hospitals. They were supposed to have a COVID-19 test, that is RT-PCR test done. And if they are positive, they were admitted to the hospitals. But eventually, as the influx of the patient increased in the previous days, so now there's a slight change in the government policy. There has been two changes, in fact. So 2 weeks back, Delhi Government Hospital and some other hospitals like AIMS, RML, Safdarjung, so basically all the hospitals in Delhi, they started shifting all the patients who are asymptomatic to quarantine centers to make space for severely ill patients, basically who require continuous monitoring of the doctors. So through that way, around 500 to 800 patients across the hospitals were shifted to these quarantine centers, and these centers have a dedicated team of doctors who are monitoring them, but they do not require medical assistance, like serious medical assistance. So their vitals are under control. They just need some assistance, some care, and the regular medicine. And most importantly, they need to be isolated. So this was going on in the hospitals, but recently the Ministry of Health and Family Welfare, Government of India, has come out with an order saying that, those who are asymptomatic and those who have mild or moderate symptoms, they can be sent for home isolation. So that means those who are positive for COVID, but they do not have severe symptoms, that means they don't have breathlessness or severe fever or cough, they can be sent for home isolation with medication, and they should continue it for around 14 days or 28 days because the test is conducted in 5 to 14 days. So if once the report comes out to be negative, then they can, of course, end their home isolation after 14 days.
So, Asa, you mentioned that we're going to start using home isolation. Here, I was wondering if there is a protocol in place for this, because we know that what about the chances of this COVID-19 patient infecting others in the house? Is social distancing possible in houses? All of these worries. Is there a protocol to deal with something like this where you are at home and you have COVID-19?
So right now, what we have are the guidelines issued by the Ministry of Health and Family Welfare. As per the guidelines issued by the ministry, they have a strict code for those who can be isolated at home. Basically, in the guidelines, it says that the person should be clinically assigned as a very mild case and by the treating medical officer. And then these cases should have the requisite facility at their residence for self-isolation and for quarantining the family contacts. So a caregiver should be available to provide care 24/7, and the room they are living in, it should have a separate toilet facility also. So that means the patient who is in home isolation, who is a complete home isolation, should not have to move around.
And what happens in case they do not have the facilities for home isolation?
So that is what they're trying to prepare SOPs for that. So maybe if they do not have these facilities, chances are high that they will be sent to the quarantine centers, the government-run quarantine centers. So they will be taking care of them.
And does it take longer with severe patients? Is there any aftercare that is, say, provided for critical patients who have survived?
So for critical patient, of course, they have to put some extra effort. And right now, what we are looking at is that mostly critical patients are above the age of 60, and they have other illnesses also. So they have hypertension, they have diabetes, they have blood pressure, they have heart issues. So all of these things need to be monitored. So when we talk about the hospitals, they have to specifically take care of these things. They need to ensure that their vitals are under control. So of course, that process takes a little more time. And if we talk about the aftercare, there's no specific guidelines for the aftercare. We only need to isolate ourselves. Even if you have been tested negative for COVID, you have to isolate yourself for 14 days as a precautionary measure.
You were listening to Three Things by the Indian Express.
Today's show, as always, was edited and mixed by our producer, Joshua Thomas. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcasts@indianexpress.com.